So hi, I'm Brianna. I'm one of the chiropractors here at Move to Move, and today we're going to be talking about pelvic floor and abdominal bracing and all things to do with pregnancy. Okay, so I often tell moms, especially as they're getting bigger with their pregnancy, to sit with a little bit of a wider stance. And having a ball at their desk, if they're desk workers, is awesome because they can shift and move around a little bit more and get less stiff. But because you have so much belly in front of you, it's hard to sit with your legs closed anyway. So naturally just opening the legs and putting more equal weight on the sit bones is really helpful and more comfortable. Feet flat on the ground. And then at times you can kind of just let the belly hang forward, and it feels nice and relieving to get the actual weight of the baby pulling onto the back of the spine a little bit. If you hold this for too long, it's going to start to hurt your low back. So it's important, as we went through abdominal bracing, you can sit with an arch for a while, but eventually you want to sit with that nice neutral pelvis, the kegels pulled up, the belly button to the spine, the ribs shortened to get that extra stability. But for this exercise, we're not going to do abdominal bracing because it's going to hinder our movement. So if you have a ball at home, this is one of the best things you could probably buy for pregnancy, other than a sleeping pillow. A big pillow would be good too. But we're going to teach just pelvic rocking on the ball first. So we're going to have slow tucking forward, and you can use the ball to roll, and then slow opening backwards. And so if you're doing it standing, it would look like what Olivia's doing. But starting sitting may be more comfortable, just to get used to having something visually underneath you doing the movement. We'll see if you're moving your pelvis or not. If I'm just moving my back and not my pelvis, the ball's not really gonna move. So a lot of people get stuck at moving their spine, but we actually with this want the ball to move and therefore the pelvis to move back and forth. Good. So that can just be gentle pelvic tilting, front and back. We can also do a little bit of hip hikes, side to side. So standing that way too, yeah, you'll have to bend your knees a little bit. And I want you to try and jack up your hip as high as it'll go. Good. And then the other side. And so again, it's easier on a ball. You have that support. You can kind of just rock your pelvis back and forth. So now I'm on my left sit bone, then I'm switching over to my right sit bone. I'm not doing this with my body. It's all coming from the hips. So if you ever watch a luau dancer or a belly dancer, they have these things down really well. But again, as we age, we don't move as much. We should be, but we don't. And we start to lose the ability to isolate our pelvis away from our spine and our low back and our upper backs. So regaining control of our pelvis separate from our spine is something that I work with patients on every single day, male and female. Because if your pelvis can't move well, your low back takes the brunt of things and people start to get injured. So we did forward and back, we did kind of lateral side to side, and now we're going to combine it all and we're going to do what we call figure eights or pelvic figure eights. So if we talk about a figure eight, we can do an 8 like the number, kind of vertically up and down, or we can do an 8 like the infinity sign, which is more horizontal. So when we're doing pelvic figure eights for the up and down 8, our focus is more so on the posterior and the anterior pelvic tilt versus these horizontal 8s will be more focused on the side to side movement. So as we start a up and down 8, we're gonna start our pelvis by rolling through the left side, making the circle over to the right, and then we're gonna come back to the center, and now we're gonna start to shove our pelvis behind us to the left, behind us to the right, and then back to neutral or back to the center. So again, push forward to the left, around to the right, come back to the middle, and then back to the left, back to the right, and around to the middle. And then you can reverse. So we'll do one reverse. So let's start, we'll go back to the right, around to the left, back to the center, up to the right, up to the left, and back to the center. Yeah, that was good. That was really good. So horizontally, we're gonna, again, focus more on the lateral movements with the pelvis. And just a brief note, if you're doing this and your legs are here, it's very hard to understand. So have that nice wide stance and then you can feel solid. So this one will start pelvis forward, and then you'll kind of sway it around to the right, rotate it to the back, and then come back to the middle. And then you're gonna go forward to the left, around to the back left, and back to the middle. So it's a little bit of a different, the actual motion probably isn't that different from the other one, but it's visually what you're thinking, and it'll slightly change what's going on. Good, so you can see Olivia's doing a little more of a horizontal movement with her pelvis. So again, you can practice these standing, you can practice them on a ball, you can practice them on a hard stool. Can't really practice them walking. You could, you could practice them hands and knees as well. So we always talk about cat-cows this way. We can do cat-cows full spine. We can also do cat-cows just the mid-back. We can do cat-cows just the low back. And we can do cat-cows only the pelvis, which is very, very hard to isolate, but this is what we're trying to do. And you can see I'm shaking here because my core is being activated so much. So from here, you could also do a little bit of figure 8, getting your hips and knees involved a bit more, but it is challenging. It's challenging that way. Or you could do a horizontal figure 8 and get that little bit more lateral motion with the hips. So play around with it. You don't have to be good at it. It's just what your mind is telling you to do, your intention, and eventually your body will start to go with it, but it can take days, months, even years to get that and to get that motion. So it's just about practicing it. Okay, so another simple exercise I want to teach you, you're gonna come on your back. And this is basically just a simple progression of our abdominal bracing, is once you brace your abdomen, so I'll quickly review, pelvic neutral, belly button to spine, ribs contracted, Kegels pulled up. You're gonna slowly from here just start to slide your heel, your right heel down into a straight knee position. And the key with this is not letting your pelvis move. And then slowly come back up. Good. So let's do this leg now too. Slowly slide. Do not change anything through the core. Okay. And then you're going to use the heel to pull and pretend you're pushing and pulling through sand or through water to go very slow and very controlled. Good. So I want to just show people, I want you to start the slide. And I want you to let your pelvis go. So you see there how she just let her pelvis relax. She totally tilted her pelvis underneath and she lost her nice core brace. So we always want to make sure that the core and the pelvis itself is nice and neutral. And then you could do 2 legs at a time, but it may be a little bit too much pressure on the abdominal wall for pregnancy. So if you're advanced and you're really good, great. If not, just do single leg at a time. Another good pregnancy-based exercise, I wouldn't call it good, but what I want you to do is if you're doing any sort of sit-ups or attempting to do some sort of sit-up, even getting out of bed or switching positions at night, I always want moms to kind of cross their arms over their abdomen and then pull their abdominal wall together. So there's something called diastasis recti where almost every woman will get it by the 3rd trimester, but because the belly is expanding so much, your 6-pack muscles, your rectus abdominis will actually start to separate away from your linea alba or your midline through your abdominal wall. And so pathologically, if I was, I'm gonna have you hold your arms down here, just down by your side. So we can always check for diastasis recti, and this is something that chiropractor or your physio will be able to do for you by finding the belly button. We're gonna check halfway between the belly button and the xiphoid process, the bottom of the sternum. And then we're gonna go from the belly button halfway between the belly button and the pubic symphysis. So we're gonna check from here and we're gonna check from here. And you're gonna make a downward motion into the center of the abs. So because Olivia's not pregnant, unless she's had a hernia or something before, you should be pretty good to go. But you're gonna do a gentle sit up, lifting your neck and shoulders off the floor. So you'll get the mom to do this, and you'll feel here, I can feel maybe like a fingernail's worth of separation with Olivia here. So if Olivia had 3 finger widths of separation, this much, in her abdominal cavity, here or here, we would call that pathological, and that's something that you should definitely then go see your doctor about, or probably more so like a physiotherapist who's really well trained with pregnancy care to help you work on controlling this throughout pregnancy. But you would also tell your OB that you're dealing with that and let them know as well. So if we're gonna do any sort of sit-up or changing positions, I always tell moms, just to prevent any sort of excess pressure and splitting of the abdominals, to give yourself a nice hug and pull your abdomen together towards the midline to protect those 6-pack muscles. From there, you can do a gentle sit-up, only lifting the head and maybe the tops of the shoulders up, and then slowly letting go, keeping the abdomen pulled together. Good. And usually I like to teach sit-ups with one leg straight. Unless you're finding it hurts your pelvis, then you can do both legs up. Good. So with Olivia, you can see she's not doing a heaving motion. She's braced her core, she's pulled her core in, and then she's only doing a very slow movement up and coming slowly back down. It's all controlled, so she's not gonna get that jerking motion. So practice here. If you were to roll over in bed, hold your abs and just show how you would do that. Good. So it gets really hard when you've got a big belly out in front of you to be changing positions, but that's why we taught core bracing initially, because that's what you can do first, and then you can get extra corset by pulling in through your abdomen and changing positions. And that looked very easy and beautiful.